Hello everyone, my name is Dorothy Waide. I'm a Karatani Mothercraft nurse, or more commonly known as a sleep consultant. When I work with babies, I do food and sleep because babies need two nutrients. So as my babies grow and their wake cycles expand more, they actually need more food in their wake cycle. So it's quite normal to feed a baby twice in a wake cycle. So first when they get up and before they go back down for a nap. Now that's not feeding to sleep. It's feeding to their nutritional requirements. So, for example, a breastfed baby after 2 hours, the gastric emptying is 16 to 18%. There are certain formulas around that have a similar, if not slightly faster gastric emptying. Then we have all the normal formulas that have slightly higher. But even if it was like a 37% gastric emptying, they're still going to be hungry if they're awake for 2 hours. So this is Sammy. Sammy is now 12 weeks old, and we took him out of the swaddle. Took me about 10 days, well no, let's say 20 days to get him out. You can see my earlier video on how to do that. Sammy is now having wake cycles of 2 hours. So he wakes up within 10 minutes of waking, approximately, guideline only. I will feed him. If he wants to be fed straight away, you feed him. But don't wait 20 minutes or half an hour, okay? And then 30 to 45 minutes before they're due to go down for a nap, I refeed him. Now, if you're feeding to sleep, then you feed to sleep at the time that you're going to put him down for a nap. So Sammy woke at 10, his nap is at 12, I'm going to feed him to sleep, so I start that feed at 12 o'clock, because that feeding to sleep is part of him winding down to go into sleep. So it takes 20 minutes for a baby to fall asleep, approximately 45 minutes for a baby to resettle. Again, guidelines only. Everything I discuss is suggestions or guidelines. You don't have to do anything. So Sammy's got a nice pitch black room, and I'm going to put him down in his room. Now what I'm going to show you before I do that is I'm going to quickly come over here, and you'll probably get my back view. Oh, actually no, I'll do it over here. That's a better way. And I'm just going to use this to get it down if I can. Oh no, hang on, let me see if I can reach up. No, I can't reach up. So are you able to reach up and, sorry, my photographer, and just pull it down, right down, and see how that is black out. There's no sunlight coming in through there, no light coming through the top, and no light coming down. That is a blackout blind. If you've got light coming in anywhere else, it is over 70, 80, or maybe a 90% blackout. Okay? So then we come back over, I've closed them, I've said good night, so I then walk out of the room, or I step back and lie on the bed or lie on the floor. Now, he's making a little bit of noise. I can't imitate it because he's a doll, but it's appropriate noise, appropriate time, and I'm actually lying on the bed. I've got my eyes closed, a little bit anxious because I don't like hearing babies cry, so I do some mindful breathing and just sit there and relax. And around the 5-minute mark, he starts to rev up a little bit, like it's like, well, hey mum, I'm trying to go to sleep, and you've helped me in the past, because don't forget I did 6 weeks in arms, and between 6 to 12 weeks I started doing part in the cot and part in arms. So I'm going to go into him, and I'm hoping, oh yes, I've got the dummy, and I'm going to touch. So one hand there, one hand there. I'm not going to open my eyes, I'm not going to talk to him, because that all stimulates. You again, imagine if you were trying to go to sleep and your partner looked in your eyes and started talking to you. There's a few choice words you'd probably use. I feel babies are the same. They're saying, hang on mum, I want to go to sleep. So one hand, one hand. Now, if he stops, that's fine, I'll just stand there. But if he continues and it's acceptable, I'll still stand there. If he doesn't stop and it's not acceptable, then I will start my rocking. So my rocking is like that, okay? And it's that movement, okay? This hand is stationary, this hand is movement, okay? Now while I'm doing this, I do my mindful breathing. And I stop. Now, some babies don't like your hand there, and they like your hand underneath their bottom, and you go that movement, okay? For babies that have been Swiss balling, then I'd be going like that, because that's a movement that they used to from a Swiss balling. So think about, if you've been doing large movement, how do I replicate on a mattress or on my body the movement I've been doing? So that's a really good movement for Swiss balling, okay? Otherwise, it's like that. So it's a cup and a push, and it is quite good movement, okay? Now, if they sleep on their side, you're going to roll them on their side, hold one hand there, and cup like that, and do your mindful breathing. And again, it's 3 long mindful breaths, and then you stop, then you do another 3, and when you stop and start, just like this is self-settling, so it is stop and start. Now, some babies do sleep on their tummies, especially for the older babies. Once they start rolling, you can't dictate how they sleep, unfortunately. So one hand on there, and you go like that. Now, if I've got twins and they're in the same cot, I would be going like that. I'll just have to hold the bed, and I'd be moving them like that. And I'd have my other hand, and I'd be doing that with them, okay? Because you need to be able to deal with 2 babies at once, okay? So I'm going to roll him back over just for educational purposes. I needed to show you those parts. Now, he's used to having a dummy, but I'm not going to give him the dummy straight away. So I'm standing, we're about 10 minutes into him self-settling, got my eyes closed. I'm about to start cupping again, so I'm going to offer him his dummy. And again, just a light touch and do my cupping, okay? It's no good cupping like that. That's not gonna help. When you're walking, you're doing big movements, and your body's doing big movements, okay? All right? Now, if you're going to cup your baby continuously when you're trying to self-settle, you're not allowing him to show you what you want to do. So it's stop and start, stop and start. Now, if you're doing the pick me up and put me down, so you've left the room, he's crying, you come in, you pick him up, give him a cuddle, you put him back down again, and you walk out of the room, and then you come back in and out, then what I would say is after the 3rd time you've come in, stay in. You're not getting anywhere. And you get frustrated, the baby gets frustrated, so make that contact with them, okay? And controlled crying. I don't believe in controlled crying. I believe in responsive parenting, allowing your babies to tell you what they're doing and intervene and help them. That is not allowing them to scream their lungs out, okay? There's grizzling, groaning, grunting down here. There's that crying that can be just like a little bit louder. Then there's this crying up here, which is not getting to non-acceptable, and then there's screaming. If a baby screams, you get in there straight away, they're telling you something. If they're an older baby and they're up here, then the importance is that they go like that. So they peak and drop down again. If they peak and they stay along there, that's when you start listening to and deciding what you're going to do. For other baby, and if it's just along here, I just leave them. And if it's a grunting and groaning, especially overnight, I keep sleeping. Okay, and we hand sleep through those noises. Now, this can be done in arms, it can be done in a cot, it can be done on a mattress. So when the babies get older, I always suggest that you do it on a mattress. And for the older babies that have been sleeping in their parents' beds, so bed sharing, and they won't go into their cot, I often suggest from a certain age, a floor bed. And then the room has to be childproof. And depending on the age of the baby toddler, then you need to put child safety rails around the mattress so that you can actually lie next to them and do the cupping and getting them to sleep. But then you get up, you've got the choice of getting up and going back to your bed. And then when they wake in the night, you go into their room, and so they learn to stay in their rooms and stay asleep there. And 9 times out of 10, whoever's doing it will fall asleep, and that's okay as well. Again, dummies, don't overplug them. Now I've lost my baby's dummy. Oh, there it is. But use it accordingly. So for a 6-month+ baby, I wouldn't be putting it in their mouth when they go to bed. I actually don't even do that with a newborn baby. Okay, I try and listen to it. They cry for 30 seconds, a minute, depends on what it's like. I either pick them up and put them in my arms, and you've seen videos on that. But for a 6-month-old baby, 3 dummies in the cot, and they can pick it up themselves if they want. And if they don't, then you go in. And yes, they do bat it out. Their hand does come and bat it out. So their hand will come and bat it out. That's normal. But they will learn, and quite often that's because they're trying to get their thumb into their mouth to suck, and that's okay. What's worse, a dummy or a thumb? I've had both pediatric dentists or various pediatric dentists telling me neither. Like they're just as bad as each other. So, you know, have a choice of what you do. Dummies are really good for reflux babies. And that's it, ladies and gentlemen and caregivers. Thank you.